The following is a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.
It's time for answers to your medical questions. And get an inside look at the latest in healthcare, medical technology, and treatments. This is Rex on Call.
Welcome to Rex on Call live on WRAL. I'm Kim Dean Holderness for Rex Healthcare. We all have those aches and pains, but when should you see your doctor? Today we're talking injury prevention, treatments, and recovery. Hips hurting, knees no good, shoulders sore? Well, give us a call and your questions may be answered here live on our program by our experts. The experts answering your questions today are Dr. Edwin Cadet with Raleigh Orthopedic Clinic and pro golfer David Mathis. He's also competing in next week's Rex Open and trying to stay injury-free. To call us here at Rex on Call, just dial the numbers on your screen. In Wake County, 919-744-3876. Outside of Wake County, call us toll-free, 877-277-6252. If you're watching us as we're streaming live on WRAL.com, you can email us your questions to rexoncall@rexhealth.com, or you can find us on Twitter. Send us your questions at Rex Healthcare. Use the hashtag RexOnCall. Now, you don't have to be an athlete to need the help of an orthopedic specialist. Here's a story of a local man who begrudgingly saw an orthopedic surgeon after a knee injury. Now he says it was the best decision of his life. Here's more.
Chris Parker is an athlete, a basketball ref for over a decade. Like an athlete, he knows his body.
There's a lot of running involved. There's start and stopping. There's a big difference in going out and jogging down the road or running up and down a basketball court doing 60 to 100 games a season.
And like an athlete,
I don't like doctors. I don't like physicians. I really don't.
So why is this athlete suddenly changing his tune?
With Dr. Galan's knowledge and the grace of God, I've been able to run again.
Let's take you back a couple of months. Parker's on the court reffing a game.
February the 22nd, I blew my left knee. It felt like somebody hit me in the knee with a sledgehammer.
Dr. Mark Galan with Orthopedic Specialist of North Carolina explains his pain.
The cartilage space is nearly completely gone on the inside part of the knee. So you can imagine the pain.
I was going bone on bone when I would use my leg, when I would walk, and it's not a very good feeling.
The diagnosis? Chris needed a knee replacement, but not the kind you normally hear about.
A partial knee replacement can be performed in a smaller incision. It's minimally invasive surgery. It's a quicker recovery time.
What are some of the emerging technologies? What's new in this field?
The thing that's unique about it is that the plastic piece between the two metal pieces actually moves as the knee moves, and it allows it to simulate a more normal motion of the knee. And that's why some patients after this procedure report that it feels, quote, like their normal knee.
That moving piece of plastic has revolutionized this procedure, and Chris is living proof. 6 weeks post-op, he only has a tiny scar to show for it.
I told you he was a seamstress in another life.
He's back doing physical therapy.
Just using the knee, and that was still actually kind of tough.
I mean, I'm not gonna lie to you, there's a lot of pain and there's a lot of discomfort for about 3 weeks. You have to be willing to push yourself through the pain.
And get this, he wants to be back in the gym running up and down the court in a couple of months. So he says he's going to be out officiating basketball come November.
That was the subject of much discussion, and we've discussed this at great length, and I've been given my marching orders, so to speak, with respect to this. At the end of the day, I'm here to keep people in the game. I'm not here to bench anybody.
Now is Dr. Edwin Cadet. Now, what types of injuries in terms of trends are you seeing in your office these days?
Well, Kim, thanks for having me here. Well, there's a popular trend in terms of sports injuries that I've been seeing. I'm sure you've heard the very popular exercise program CrossFit, and I've participated before in the past. There's a wide range of injuries what we've seen with CrossFit, and not just CrossFit specifically, but very high impact, high energy exercises that really are focusing on Olympic lifts and endurance. And the type of injuries we see sometimes are overuse injuries, particularly shoulder injuries, knee injuries, hip injuries, back injuries, etc. And the wide variety of these injuries can come from the novice person versus the very experienced person, and it can play, a lot of it can be either fatigue or just improper technique. So we're really trying to get these athletes to learn proper form and to kind of know when their body is feeling fatigued so that they can alter and modify their weight and their reps so that they don't show up in my office. So.
Right. But and that was going to be my question: is CrossFit is so popular? I feel like every 3 blocks there's a new, a CrossFit location opening near you. So people aren't going to stop doing it. So how do they need to proceed with caution?
And neither should they proceed to do it. I think that everyone has to listen to their own body, and I think that the most important thing is form and technique. And I think a lot of these CrossFit gyms do a good job in mandating their participants to participate in some sort of form program before starting a formal program, before they start really using the heavy lifts. So I don't think that they should stop doing it. I just do think that they should really focus in on form and really listen to their body and know when their body may be fatigued. And at that point now, they should be able to be communicating with their coach and telling them, like, listen, this is what my body's feeling like, maybe to modify the amount of weight or the reps, Okay. But I don't think that they should stop doing that. I think it's a great all-body exercise, but, everything in moderation. So you just have to be familiar with your expertise and your level that you're participating in.
And knowing your limits, for sure.
Absolutely.
And there was already a question about what's the difference between bursitis and a rotator cuff injury. And I swear I have a problem because I hand stuff back to little children in the back seat. I think I have a rotator cuff injury, but maybe it's bursitis. Tell me, what is it?
Well, I have a model here. That's a question I get every day.
Okay.
So this is a shoulder model, and what we have is, here's the humerus, which is part of the shoulder, and this is the scapula. The rotator cuff are 4 tendons that attach to this bone, the humerus: the subscapularis, supraspinatus, infraspinatus, and teres major. And bursitis is an inflammation of the bursa, which is a covering of these tendons.
Okay.
So everyone says, well, what's the difference? Bursitis versus rotator cuff tendonitis versus tear.
Right.
Again, bursitis is just inflammation of the covering of the tendons. That covering helps the tendons to glide within the shoulder. And a rotator cuff, again, is the tendons that are responsible for lifting the shoulder, and the tendons itself attach muscle to bone. So you can have inflammation of that tendon as well, or you can have a tear. So those are the differences between the 2 different conditions.
Well, how do you diagnose the difference between that if somebody came into your office with shoulder pain?
It's a great question. Sometimes you can't differentiate between just bursitis or early tendonitis or a frank tear. Some objective things that we do is measure the strength. Like I mentioned, the rotator cuff helps to lift the shoulder and maintain strength to the shoulder. So weakness can elicit kind of a clue that maybe there is a rotator cuff tear. And again, you can have a partial tear or a full thickness tear. And so, that's the dilemma that we face clinically. Sometimes we need to get more advanced imagings like an MRI. X-rays also are a very important factor in that. Sometimes you can think you have bursitis, but maybe you have arthritis. Or if you fall, maybe you have a fracture. So, radiograph, clinical examination, and sometimes advanced imaging such as MRI or even ultrasound can help us differentiate whether or not that's just truly bursitis or, in fact, there's actually a full thickness tear or even a partial tear of the rotator cuff.
Okay, real quick before we head into the break, what are some of the trends? We had talked about some stem cell. Tell me what this type of stuff you're doing in your office right now.
So it's a great, the future for orthopedics is really biologics. And so one of the things that we offer in our office is something called platelet-rich plasma, where you can actually extract some of your blood and spin down the platelets, which excrete growth factors. And the growth factors are part of the things that are able to help us to heal either with tendons or just with blood clotting. So what we can do is we can take the blood, spin it down, get the platelets, and actually inject it back in the area where there is pain, particularly for the tendinitises, such as lateral epicondylitis, or golfer's elbow, tennis elbow, patella tendinitis, and there's even been some data to support its use in early arthritis. So it's been a very it's still the exact people that benefit from it is still unknown, even the amount of injections that you can get. But that's one of the modalities that are on the horizons that we can offer our patients.
And you're doing that in your office?
In our office, it really takes about 5 to 10 minutes.
Wow.
We do it under a sterile technique. We sometimes use an ultrasound to really identify the area where we need to inject the PRP injection. And it's really not that invasive in terms of operating room or not. We do it right in our office, and thus far, patients have had some nice results with them.
Awesome. Okay, coming up next, we have David Mathis. He's going to share his tips for staying injury-free, and later, more of your questions answered here by our experts. Stay with us. Welcome back. This is Rex on Call live on WRAL. Today we're answering your questions on injury prevention, treatments, and recovery. If you have questions for our experts, call in now. In Wake County, 919-744-3876. Outside of Wake County, toll free 877-277-6252, or email us your questions to rexoncall@rexhealth.com. We're here with David Mathis, a pro golfer on the PGA Tour. We're going to see him next week in the Rex Open, and everybody in the studio has already been getting their golf tips answered. But we're going to talk about, I saw you back there working on swings, but let's talk a little bit about injury prevention. Sure. We're very similar age. You're 40 years old, and that is, I'm going to call that young. But in your profession, they're blaming your age on some of your injuries.
Sure.
It feels weird to hear.
It does feel weird. I had rotator cuff surgery about 10 years ago, and stemming from that, leading up, now 10 years later, I had a ruptured bicep tendon this past November, and from constant repetition, hitting shots to my age, they say, and then a prior history with rotator cuff problems. So, when things are feeling good, you don't normally stay on top of the things that aren't that fun to do. Band things you don't see. You work out and you see muscle difference, which is great. But the things that you don't see, like rotator cuff, you don't have a tendency to work on.
Yeah, and not until it's bad.
Correct.
That does it become very bad. Right. So tell me, you do band work. What else do you do?
I do band work. I do light work with bicep dumbbells. I do some push-ups. It's a lot of weight, but I do some push-ups. But mostly band work from pretty much every direction I can possibly think that I might not only move in my golf swing, but move just in life. So, some above my head, and it's just, some of that stuff's boring, but it's
But you
preventative.
have to do it.
I have to do it.
So how do you stay motivated? It is pretty boring.
Well, it is boring, and if I want to continue to play professional, golf going forward for the next, let's say, 10 years, then it's just something that I have to do. I wish I would have stayed on it more. Then, chances are I might not have had this injury that I'm going through now.
Yeah.
And
how much does fatigue have to do with it? Because you have a 2-week-old baby in the house.
I do. Yeah.
So how much does fatigue have to do with these
Well,
injuries?
that makes me want to do it less. No, it's just something that I just, I stay on top of it. I have a band. It's like a rubber band. I tie it in a ball. I can put it under the door, on top of the door, or I'll put a hook around and put it around the doorknob, and just do all the motions that I can think of to strengthen those muscles around. Because when I'm hitting a lot of golf balls, they fatigue, and that's where the problem comes from.
The problem. And give us a quick plug for the Rex Open. It's coming up very soon.
It is coming up. Yeah, it's going to be awesome. Looks like the weather's going to be great. The golf course will be in fantastic shape. The Rex puts on a great event.
And your shoulder is going to be in great shape.
I should be, Lord willing.
Okay, awesome. Quick questions are coming in for Dr. Cadet. Jane hurt her knee yesterday on the outside of the knee. She can't walk very well. Should she see a doctor, or should she just suck it up?
Well, I would say that if this is pain that's a little different than what she's experiencing before, then the intensity is pretty tough, then I would say that she should probably see her physician. Other things that she should try is maybe resting it a little bit, anti-inflammatories, a little ice, a little compression, and if that doesn't get better within the next couple of days, then I think that she should see her physician.
Okay. Coming up, we're going to answer more of your questions. In Wake County, call us at 919-744-3876. Outside of Wake County, toll free 877-277-6252, or email us your questions to rexoncall@rexhealth.com. Stay with us. Welcome back to Rex on Call here live on WRAL. To reach us here, call one of those numbers that are on your screen, or you can email us your questions to rexoncall@rexhealth.com. We've got a lot of questions to get through, so let's get to it. Gloria wants to know, her right hip has a lot of pain. X-ray didn't show anything. What could it be?
That's a great question. There's a lot of things that it can be. Before in the past, we didn't have a good understanding of what the hip what causes pain in the hip. Now we know there are a lot more about that. One thing it could be is something called a labral tear, particularly if x-rays, quote unquote, didn't show anything. The labrum is a piece of cartilage inside the hip, and particularly in young patients or even older patients who have minimal signs of arthritis, that piece of cartilage can cause a lot of pain. So I would say one of the things that it can be is a labral tear. And there's also a lot of tendons that cross the joint. It could be tendonitis, hip flexor tendonitis. It could also be just a hip strain. Even if the x-rays really don't show a lot of arthritis, it could be the beginnings of arthritis. Again, seeing your physician as well as advanced imaging can also help to differentiate whether or not it's early arthritis versus a labral tear versus other tendinitises.
So there's lots of things out there.
Lots of things.
Okay, Sarah from Apex has knee arthritis along with no cartilage. What can she do for aches and pains?
So that is a tough problem, but there's a lot of solutions that she can do. Number one, keeping the knee fit. Exercise has been shown to improve knee pain, particularly in the setting of arthritis. So making sure that the muscles around her knee are well fit. Also optimizing a height-weight ratio. So nutrition and exercise can help to maintain that. So everyone needs to try to optimize the height-weight ratio and make sure that the load that's going across the knees are not deteriorating her function and her pain.
Okay. In 2012, Aubrey from Spring Hope had a total knee replacement. She hears pops and feels pain on the outside of her knee when walking. What's the cause of that?
There's not one single cause for clicking and popping after total knee replacement. It could be a lot of things. It could be scar tissue. It can be the kneecap maltracking. There can be a lot of things that can cause it. My recommendation for her would be to see her surgeon that she originally had the total knee replacement and just go in there for evaluation and make sure that nothing seriously is wrong with that.
Okay. Miss Burwell from Henderson experiencing some sore lower back pain and sharp pain randomly in the back of knees. What could cause this?
Well, that could be a little bit of a pinched nerve or something called sciatica, particularly if she's saying the pain starting in the back and then start radiating down the back of her leg down to her knees. So sciatica basically is just pinched nerves within the back that can be pretty severe, and it can either be that. It can also be because she's walking abnormally, she's putting a little bit of abnormal stress across the knees. So a lot of things can be caused by that. It could also be some hamstring tightness because her back is not functioning well and she may be walking altered. So a lot of things can be causing her pain in the back of the knee.
So she should go see a doctor.
She probably should see a doctor.
Now let's hear from Raleigh native and last year's Rex Open champ on how that win changed his life.
Raleigh's own Chesson Hadley is making a name for himself. What's that name again?
I was introduced this year in Palm Springs as Chesson Hadley.
Really?
First tee.
We can laugh all we want about it now because Hadley is all smiles. This has been the best golfing year of his life, and it all started at the Rex Open.
Kind of wrapped up the year. I mean, even though there was still a bunch of golf to be played, I was just so content and satisfied just winning in your hometown. It was really special.
Hadley finished third on the Web.com tour. He won the season-ending championship in Florida and earned a tour card, then won his first PGA event in Puerto Rico.
I feel like I've been able to kind of let it ride a little bit, kind of keep the dice out there. And so, it certainly helped with how I've played on the PGA Tour this year.
Now ranked 61st in the world, Hadley's hit it big time, but holds a special place in his heart for this tournament.
I feel like I was 10 years old when I first came out here and started watching these pros, which is even more special to win in your hometown.
As for the sponsor, let's just say Hadley knows his way around Rex Hospital.
I have a 5-month-old son. His name is Hughes, and I was born at Rex. My wife was born at Rex. He was born at Rex. So it was a really, we thought about naming him Rex. I'm kidding. I'm totally kidding.
Rex is a great name. It's Raleigh's premier golf tournament featuring golfers from PGA's Web.com tour. See future stars of the PGA during the week-long event. This is a family-friendly event, and it's all for a great cause. For over the past 26 years, Rex Charity Golf has raised more than $8 $1.5 million to support patients at Rex Hospital. To find out more information and to buy tickets to this great event, go to rexhospitalopen.com. And remember, if you're looking for a doctor or need a direct referral, you can call the Rex Health Net. It's Rex's free telephone information service. The number is 919-784-4490. We're going to have a final round of your questions right after the break. This is Rex on Call. Back to the show. This is Rex on Call, and we're taking a final round of your questions with both our experts on the couch now. Okay, David, heading into the Rex Open, what are the injuries that you're looking to hold off?
Well, I'm trying not to have any more issues with my rotator cuff, and so it feels really strong. I've done a lot of band work going forward, and so it sounds like from Dr. Cadet here, I need to start icing like a baseball player at nighttime, which would kind of help. Not that I'm injured, so to speak, but that it would definitely help me. So.
See, everybody gets help here at Rex on Call. Okay, we actually have a question in from Beatrice in Raleigh. She has a rotator cuff spur. Yes. So is there physical therapy that would be useful for that, for a spur?
Yeah, so basically the spur is basically a piece of bone that may grow underneath the acromion. And that doesn't require surgery all the time. In fact, we try non-operative management first. We try anti-inflammatories, sometimes injections. Doesn't mean the spur goes away. It just means that the inflammation caused by the bursitis we talked about before helps to get better. And then ultimately, if physical therapy, anti-inflammatories, injections don't help, then there are surgery options for that, but the first line of treatment is surely not surgery and surely non-operative management.
Okay, a meniscus tear, what sort of treatment do you recommend?
Again, meniscus tears can be managed non-operatively first. We can try physical therapy, non-steroidal anti-inflammatories, icing. The issue with meniscus tears is that unfortunately they don't heal on their own. So we can try non-operative management, and that can help to relieve the symptoms, but sometimes they do come back. And then if they do come back, then we can offer really minimally invasive techniques to either repair them, depending on their age and the size and the character of the tear, or sometimes we just have to clean up the meniscus, and that can be a really short recovery. If we have to repair the meniscus, a little longer recovery, but we'll often do what is best for the patient, and that will determine the size of the tear, age of the patient, whether the ability of the meniscus has to heal. So
we did get a question about icing, which brings me back to David. So should you always ice, or is there a time when heat is appropriate? So you're saying ice for him, even if he's not actively hurting.
This is why usually I say heat before you're doing an activity and ice afterwards. Heat helps to prime the muscles for that activity, whether or not it's jump roping or, jump roping, taking a brisk walk, or even a heat pad or a hot shower. That helps to prime the muscles for your activity, and then ice helps to vasoconstrict the blood vessels to help lower inflammation. So in general, I like to say heat before you do something and icing after an activity.
Should he be heating before he plays this weekend?
I think he get a nice sweat before he gets on the range, and I think
work
you're right.
Work it out a little bit. Okay, torn muscle in this caller had a torn muscle in her thigh. Is that something that can be repaired, or how do you even treat a torn muscle?
Yeah, usually you don't have to treat torn muscles surgically. Usually the muscle will heal with scar tissue, and usually physical therapy. We talked about ice. Anti-inflammatories usually does a job. So, and usually that's non-operative and really minimal interventions for that.
Just rest for a little bit.
Yeah, rest.
Okay. As always, consult with your physician about any health concern. Thank you guys so much for joining us. And thanks to our phone bank. They're still busy over there taking calls. Join us for this next month. The topic on Rex on Call is weight loss surgery. Our experts will answer your questions about who the ideal candidate is and what it takes to maintain results. Join us on June 16th here at WRAL. Email us your questions on this weight loss surgery ahead of time using rexoncall@rexhealth.com. We will see you next time. Thanks for joining us.
This has been a paid commercial program. Views expressed belong to its participants and are not necessarily those of the management and staff of WRAL or Capital Broadcasting Company.